Hello everyone, welcome back to my YouTube channel. So in this video, I'm going to talk about the IG fluid and mainly focusing on the crystalloid fluid. So basically, there are the two type of IG fluid. One is a crystalloid and one is a colloid. So I'm going to focus on the crystalloid fluid. So let's talk about what the IV fluid is. IV fluid or intravenous fluid are the sterilized solutions given directly into the vein that are used to treat dehydration, replace lost fluid, and maintain electrolyte balance or deliver the medications. Crystalloid are the clear fluid that contain the water and electrolyte that easily move between the blood vessel and the cell. There are the three types of crystalloid fluid: isotonic, hypotonic, and hypertonic. Isotonic fluid have the same osmolarity or concentration as blood plasma. That means they do not cause water to sift in or out of a cell, and they stay in the bloodstream, making them ideal for volume replacement. The example of isotonic fluids are normal saline, 0.9% of sodium chloride, Ringer's lactate, dextrose 5% in water, which is initially isotonic but become hypotonic once infused into the bloodstream. Isotonic fluids are the go-to for treating low blood pressure volume like a trauma, bleeding, or severe dehydration. They help quickly expand the intravenous volume. Patients often lose fluid during surgery. Isotonic fluids are used to maintain their blood pressure and the fluid balance during and after the procedure. Time is critical in shock or sepsis. Isotonic fluids like a normal saline are used immediately to restore the perfusion and support the circulation. Large fluid loss through the burn or trauma require aggressive fluid replacement, and isotonic fluids help to stabilize the patient early on. Lactated ringers contain electrolytes like a sodium, potassium, and calcium. It's deal when the patient need more than just water, like in metabolic acidosis or after major fluid shift. Always monitor your patient. Even though isotonic fluid are safe, too much can lead to fluid overload, especially in heart or kidney patient. Hypotonic IV fluids have a lower osmolarity than the blood plasma, meaning they have a less solute and more water. When infused, they sift water into the cell, helping to rehydrate them. The example of the hypotonic IV fluids are 0.45% of sodium chloride, half normal saline, 0.33 or 0.2% of sodium chloride, 2.5% dextrose in water, 5% dextrose in water. So 5% dextrose in water is isotonic fluid, but when it goes into body, it becomes a hypotonic IV fluid. While hypotonic fluids are helpful, they are not for everyone. They are serious risk like cerebral edema, especially in head injury or a stroke patient, hypotensive since they move the fluid out of the blood vessel, and it can also cause the cell lysis if used in excess. As a nurse, always monitor your patient closely. If you see confusion, decreased consciousness, or respiratory distress, escalate to the doctor. We have to also monitor the neuro status, watch for fluid overload or low blood pressure, never give to increase intracranial pressure or burn patient. Hypotonic fluid is used mainly in these three conditions: diabetic ketoacidosis, hyperosmolar hyperglycemic state. These conditions cause water loss from the cell, and hypotonic fluid pushes water back into the cell. Another condition where the hypotonic fluid is used is the hypernatremia, used when the blood sodium is too high. Hypotonic fluid dilute the serum sodium and move water into the cell to restore the balance. Hypertonic fluids have a higher osmolarity than the blood plasma, meaning they contain more solutes like sodium or glucose than what's found in the blood. As a result, they pull water out of the body cell and into the bloodstream, helping to expand extracellular volume and reduce the cellular swelling. Example of the hypertonic fluids are 1.5%, 3%, or 5% sodium chloride, 5% dextrose in normal saline, 5% dextrose in ringer lactate, 10% dextrose in water. It is important to monitor for fluid overload, pulmonary edema, and hypertension. Always use central lines for the highly hypertonic solutions like 3% sodium chloride. It is important to frequently check the neuro if treating hyponatremia or cerebral edema. Was for electrolyte balance. Hypertonic fluids are used in the conditions like hyponatremia, cerebral edema, and volume expansion in hypovolemic or shock. In case of severe hyponatremia, when the patient's sodium drops dangerously low below 120, hypotonic saline helps rise sodium level without giving a large volume. It must be infused slowly to avoid the brain damage. In case of cerebral edema, when the patient have head injury or a stroke patient, we need to reduce swelling in the brain. Hypertonic fluid help by drawing the water out of the brain cell and reducing the pressure. Normally used in the emergency and neuro ICU. In certain shock cases, hypernatremia fluids like D5 normal saline can pull fluid into the bloodstream and help to improve the blood pressure. In those cases, it's used with the caution and typically in combination with the isotonic fluid.